It is December 25th, evening, Christmas Day. Tomorrow is my surgery for the port catheter. They will be putting me under anesthesia. I'm not supposed to eat 8 hours beforehand, so there's a little bit of concern for seizures or just, blood sugar issues. So there's a plan around it. I'm supposed to get up early, have a meal, and kind of drink fluids up until 3 hours before the surgery, and then I can't have anything. So, and they told me that they would put a note in my chart to put in a glucose IV, I believe is what she called it. She told me to make sure to mention it too as well, just to prevent any issues. I saw the radiation oncologist last Thursday. It was a bit of an abbreviated visit because the fire alarm went off, and the modern fire alarms they have in each individual examination room is like a strobe light, so I had that was kind of a close call. Was not a good. I mean, he's a nice doctor. He seems very competent in what he does. It was an upsetting visit. I was not happy with him, and I was not happy with what he told me, what his plan was, what he wanted to do. He said they would likely want to do radiation after chemotherapy. The plan is for me to go into surgery and to do a double mastectomy. He wanted to do radiation at that time. And he said the type of radiation that he would do would be really, really aggressive. It's going to be a lot more than a sunburn. He said because of, and I don't understand the logic behind this, but I guess this is the standard procedure. When someone is premenopausal, they're younger, they can handle much higher doses of radiation, but they are also the most susceptible to having long-term effects from the radiation. But for some reason, regardless of that, the standard treatment is to hit younger people with much higher, more concentrated doses of radiation. So it would be, several months of radiation. He said he'd probably do an aggressive round, so I would be in like every other day for some radiation. He said it would come to the point where it would actually cause my skin to have like open, weeping lesions, because he wants to use the radiation to the point where it penetrates through the skin, through the muscle wall, and into my ribs. So I was not happy about that. I'm not doing it. I'm just not doing it. He also said that I would like to, think more positively and think, say that ideally the chemotherapy will, melt this thing down and we won't see hardly any trace of it, and you will be able to, opt out of radiation if you feel like this is not something you want to do. He said, but because of the size of the tumor you have, and because of your age, the standard procedure regarding radiation is to do this really aggressive radiation right after the mastectomy. Now, if I were to do that, the radiation would also keep me from having reconstruction for, he said, up to a year before they could even start reconstruction. He also said that the radiation would do so much damage to my skin and the underlying fascia and muscle structure that the reconstruction would likely not ever look right. It would be morphed. So that was another reason I was like, I don't see any logical reason to do this. It just doesn't make sense to me. I guess the concern when you have the double mastectomy, is most of all the breast tissue's gone, except for little tiny microscopic bits. And those bits, there's still a 2% chance that cancer can come back in those bits. So there's also a 2% chance that the cancer can come back in the skin or in the muscle wall or in lymph nodes that, are not taken. Still, I'm really not on board for radiation. I really don't want to do it. I'm not happy with the amount he wants to use on me. At this point, I feel like if chemotherapy fails, then I will, if it completely fails and the tumor doesn't go down, and it looks like it's affecting lymph nodes, or more lymph nodes than they think it is, then I might, sit down and have another discussion with him about a more mild form of radiation that's more specific to just, those layers. But I'm not going to let them do that really aggressive level of radiation where it's going to go all the way through. And of course he said, we'll give you painkillers and creams and lotions and it'll get you through it, but I don't care what you give me, you're not doing that. I'm not on board for that. So that's just off the table right now for me. So, right now, surgery is tomorrow for the port catheter. It's, I think they said, a 3-hour procedure, I believe she said, or maybe I will just be in the hospital for 3 hours. It's outpatient, so I won't have to spend the night. They are using anesthesia though, so there's a bunch of rules and things that I have to do. I have to use a special shampoo tonight, or not shampoo, but like body wash, like a surgical scrub. To take a shower tonight, have to take a shower in the morning, have to make sure I do this, with the surgical scrub. Once the port catheter is, they say that it can be used for chemotherapy as soon as the next day, sometimes the same day, depending on, I think with my procedure would have to be the next day. But I am scheduled to get my first round of chemotherapy January 3rd. I'm also scheduled to have more blood work done that day beforehand, and I'll also be meeting with my oncologist again beforehand. Being that it's Christmas Day, I saw a lot of family recently, and a lot of them have had experiences with cancer, and I've been told from a number of people now that I should consider seeing a naturopath to kind of help with the side effects of chemotherapy and the nausea and some of the other issues you have, and just kind of helping the chemo be more effective by giving your body what it needs to fight on its own. So I'm probably going to do that. I'm not sure when. I haven't picked a date, or there's a naturopath that Andrew's mother used that I'm going to try and make an appointment with. The oncologist is still insisting that I have the CT scan because of the holidays, and they're off at, there are people being out and their schedule being crazy. I haven't been able to make that appointment yet, but that is still the plan, so that is a pending, and that's just to check the rest of my body, just to make sure that she said it is possible for it to skip lymph nodes or certain areas up here and pop up somewhere else, so just to make sure we're checking. I don't know about the neurologist yet. She told me last time I talked to her that she didn't want me to start chemo until I saw a neurologist, but because her office dropped the ball on getting me that appointment, we can't prolong my treatment anymore, so I'm going to start chemo, and I'm assuming she's still going to want me to meet up with a neurologist in the next few weeks. So that's all. I think that's all the information I have right now. I'm feeling a little more overwhelmed about it today, maybe because I'm going into surgery tomorrow, maybe because just, having the holidays and seeing family and, seeing a number of people get upset upon seeing me, and people have told me that I look good, I don't look like I have cancer yet, but I had a lot of reactions the last few days that kind of surprised me, just people getting emotional and being supportive and loving, and of course, but just seeing all the other people's emotion has kind of made me feel a little emotional today, so that's to be expected, though, I guess. Everybody's going to react to it differently, and I'm sure it's difficult to see, your kids or your sister or, your family member going through something like this, so I'm trying to be patient with everybody. But otherwise, still doing pretty good. Today was kind of a high and low day, because it's Christmas, and I got to, do the Christmas thing, and spend with family, and eat junk food, and see Christmas lights, and listen to Christmas music. I'm feeling pretty good. I'm just a little nervous about tomorrow. And I know it's not supposed to be a big deal. It's really going to be the easiest procedure out of all of this, so. But, you can't help but worry a little bit and be a little nervous. I guess I will make another one of these after surgery tomorrow. Maybe not directly, probably after the anesthesia wears off, or maybe the following day, just because I'm not sure how I'm going to feel after surgery. And then I will definitely do one the day I start chemo, maybe one before, one after, maybe one during, because I'm told the infusion for chemotherapy, that first one at least, and maybe all of them, but definitely the first one is going to take 5 hours because they want to give it to you really, really, really slow and really, really small doses. I got to talk to my stepmother the other day, and she's a nurse, so she's actually worked with oncologists, so she gave me a lot more kind of detailed inside information about the process and, you know, how their department works and kind of just letting an inside view or inside perspective, which was kind of cool. It kind of made me feel better about certain things and anxious about other things, and kind of made me feel like I did have the right to disagree openly with my radiation oncologist and with my oncologist. So, you know, if I'm not okay with what they want to do, or if I feel like they're just kind of telling me what to do. So it's still, I felt like she kind of empowered me again, that it's still my treatment, it's still my decision. And, you know, everybody's been saying that, but I don't know, just hearing it from somebody who works in the field, who actually is, you know, one of the nurses that works with other oncologists in Pierce County, it just kind of made me feel a lot more better about being able to say I'm not okay with that, and no, I'm not going to do radiation unless, you know, this completely fails. Then we'll talk about it, but I'm not okay with what you want to do right now. So that was good. I think that's all I have for right now, but yes, more pending, I suppose.